Good day, I am Althea Bistil from BSN1H and I will be performing the taking of vital signs. So first we will be checking the patient's chart to know who the patient is and to know the baseline data. So patient's name, Vistil Joanna Claire C. Date of birth, June 24, 2006. Room number null 1, pin number 01234 under the service of Dr. Sotes. So diagnosis or impressions, hypertension, problem or chief complaint, knee pain, condition stable, vital signs monitoring Q4, allergies none, ambulation no restrictions, diet low salt diet, nursing orders Q4. So after reading the patient chart, you will be proceeding now to the medical hand washing. So after doing the medical hand washing, we will now proceed in gathering the materials needed and check its functionality. So first, we'll check the thermometer. Okay. Good to go. Next is the stethoscope. And then the sphygmomanometer. And now you're ready to see your patient. Ma'am, I will go inside your room. Good morning, ma'am. Ako din si Althea Bistil. Ako yung student nurse. Gikan sa Lasay sa buntag hanggang sa alas 2 sa hapon. So, pwede kong mahayos ng pangalan, ma'am? So, magkuha ko sa imong vital signs nga. Apil na din yung temperature, imong pulse rate, respiratory rate, o imong blood pressure. So, wala, makafeel kag discomfort and nagkahuot sa cough, ikuha na ko sa imong blood pressure. So, ang purpose ani nga procedure para ma-check na to ang progress sa imong health, pinaagi sa pagkuha sa vital signs para ma-compare na to sa imong baseline data nga na sa imong chart. So, okay ra ko ni butang bali, ma'am? So, importante po, ma'am, nga relax ka during sa procedure para makuha na to ang accurate nga resulta. So, dapat po nahihilom mapaligot. So, magsugot na sa imong temperature, ma'am, ha? So, get the digital temperature from the container and start wiping it from the probe tip. Make sure that the patient's arm is on the axillary side. So once you hear the beeping sound, this indicates that the temperature has already been taken. So ma'am, your temperature is 35.7. So after that, you're going to clean your digital thermometer with a alcohol swab. So you will be cleaning it starting from the handle, going to the probe tip. And then, place it back to the container. So we will now proceed in taking the pulse rate and the respiratory rate of the patient. Comfortable ra ka na ang position, ma'am? So, karon magkuha ko sa imong pulse rate o gimuhang respiratory rate. So, you will now start on checking the pulse rate of the patient. So, take note of the rhythm, volume, and tension for 30 seconds. And then, check the pulse beat for 1 full minute. Ha? So after counting the pulses without changing the patient's position, watch the rise and fall of the chest. So count one inspiration and expiration for one respiration. So count for 1 full minute. So after checking for the pulse rate and respiratory rate of the patient, you may now proceed in checking the blood pressure. So make sure that the patient is positioned comfortably. The left arm is the ideal side in taking the blood pressure. So we will be folding the sleeves first. So remember the rule when placing the cuff on the patient's arm. You have to unroll as you cuff and roll as you uncuff. Adjust. Okay. You have to make sure that you place the cuff 1 inch above the antecubital fossa. And then make sure that the gauge level is also at 0. Locate for the brachial pulse. Okay, there. So, ma'am, abo ako sa imong blood pressure, ma'am, ha? Medyo uncomfortable din siya. Remember, roll as you uncuff. And then, unfold the sleeve right after. So, when there is a need for you to recheck the blood pressure, you have to wait for 1 minute. So remember that the first distinct sound that you will hear is the systolic blood pressure, and the last distinct sound will be your diastolic blood pressure. So right after you take all the vital signs, you will be jotting down everything in your jot down notebook. So ma'am, your temperature is 35.7, and then your PR, your pulse rate is 81 beats per minute, and then your respiratory rate is 15, and then your blood pressure is 110/60. So thank you, ma'am. So back here at the nurse's station, you may now proceed in documenting the vital signs that you have obtained from the patient. The temperature is 35.7. Then pulse rate 51. Then for the respiratory rate 50. And the blood pressure is 1.6. And that would be all for the taking of the vital signs.